एफएमजीज के लिए जो भी अभी गाइडलाइंस बनी है कि हाँ तुम्हें 1 साल की पूरी इंटर्नशिप करना जरूरी है. सो व्हाट इज योर टेक?
So this way we learned, and this was really good from the 4th year till the 6th year. It was all. Then next moment was for me to give the GOZZ exam. So you have to enter into the room and you have to act like you are a doctor who is a working professional, and you have a patient in front of you. You have to see the patient. You have to, there are protocols that you need to follow. So people say that कि आप जब बाहर जाते हो you don't have like practical skills या practical skills आपके उतने develop नहीं हो पाते. So that is a kind of a myth. अगर वो रशियन ने बता रहा है कि मुझे घोटने में खाना को घोटने में मुझे दिक्कत हो रही है, ठीक है, how will you understand until unless you understand the language?
कि भैया कोई तो हमें XYZ एजेंट XYZ ये बोल रहे हैं कि यहाँ चले जाओ, यहाँ से तो USMLE ऐसा क्लियर हो जाएगा, यहाँ से PLAB ऐसे क्लियर हो जाएगा, यहाँ से बच्चे जर्मनी जाते हैं, ऐसा कुछ नहीं होता. We need some myths. So we won't be like कि जल्दी से बना दिया बस रशिया 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 सबसे अच्छा रशिया, नॉट लाइक दैट. अब जो जूनियर्स आ रहे हैं उनके लिए क्या है पॉसिबल ऑप्शन? सो हेलो एवरीवन, और जैसा कि तुम्हें याद होगा कुछ टाइम पहले हम लोगों ने एक स्टोरी डाली थी दैट वी इनवाइटेड डॉक्टर सौरभ ऑन आवर चैनल फॉर वेरियस क्वेश्चंस, और तुम्हारे क्वेश्चंस ही इतने ज्यादा थे कि हम लोगों ने उसको प्रॉपर सेक्शन वाइज डिवाइड किया. एंड वेलकम एवरीवन, आई एम सक्षम, आई कंप्लीटेड माय 5th ईयर फ्रॉम रशिया एंड वी इनवाइटेड डॉक्टर सौरभ. उनके बारे में मैंने स्टोरी डाली थी, यू गाइस नो अ लॉट, बट नाउ let's get to know more of things and how he accomplished all of the posts that he's working on, and the most specific questions which is related to post graduations and accreditations कि वो सब क्या होता है, कैसे होता है. अब समझाने के लिए सबसे अच्छा बंदा वही होता है जिसने वो सारी चीजें करे हो. So welcome Dr. Saurabh on our channel.
Thank you
And
so much, Saksham.
yeah, thank you so much
Thank you
for
so much
giving us
for
the time.
Thank you so much for inviting me on your channel,
Yeah.
Saksham. It's a pleasure for me to be on your channel. And today, it was really good news for me that you tried to connect to talk about the accreditation exam, to talk about the life and how to study and listen all the questions that you put up before. Okay, so it was really like I was really happy to hear that somebody is making video on this particular topic, so that upcoming students are having like like lot of queries, lot of questions in their mind, like how should they take admission, where should they take admission, how should they prepare for the examination, and after completion of their entire course,
Yeah,
how
what
what
will
should they
happen?
do. Yeah,
Yeah.
so all of these questions I will answer today. As you have mentioned
Yeah.
me, I'll answer all of these questions.
Yeah.
And so very fast, let me introduce myself.
Yes,
I'm
Dr.
Dr. Saurabh Kumar, and I'm currently doing radiology PG clinical residency in Russia, and I'm a second year student right now. So, of course, I have given my accreditation exam, which is a very compulsory thing. When you take admission in PG in Russia, you have to pass through the examination. And मुझे scholarship मिली थी रशियन फेडरेशन में, जो रशियन हाउस होती है इंडिया में, वहां से मुझे स्कॉलरशिप मिला था. सो माई इंटायर कोर्स इज फंडेड बाय द रशियन हाउस. सो मुझे यहाँ पे पैसे नहीं भरने पड़े, एंड द गुड थिंग वाज दैट कि मुझे स्टाइपेंड भी मिला. सो लाइक अ स्मॉल, नॉट अ वेरी बिग अमाउंट,
Yeah.
बट like like a small amount, a decent amount that I can sustain with.
I
So
think
मेरा like जेब खर्च
इंडिया से तो इट्स
छोटे
फार
में बोलो
बेटर.
तो जेब खर्च निकल.
बिल्कुल
Yes.
बिल्कुल, इट्स
So
फार बेटर सिचुएशन देन इंडिया.
yes, एक्चुअली मुझे मिला. दैट वाज बेस्ड ऑन माय एकेडमिक मार्क्स,
या.
जो मुझे लाइक जो 6 इयर्स में जो मेरी एकेडमिक स्कोर थी उसे देख करके. एंड देन जो भी मैंने चीज़ों में मैंने पार्टिसिपेट किया था, फॉर एग्जांपल लाइक बहुत सारे फोरम्स हुए थे जहाँ पे डायलॉग्स हुए थे ऑन मेडिकल एंड सम पॉलिटिकल इश्यूज ऑल्सो. सो आई पार्टिसिपेटेड इन ऑल ऑफ दैट, एंड आई ऑल्सो रिप्रेजेंटेड इंडिया इन वन ऑफ द ब्रिक्स. Like there was a BRICS Plus meeting, and there were like few countries who participated. So I was representing India in that also. And the very important thing is that कि आपको journal लिखना होता है. So there's a terminology journal. So it's like a kind of like a publication from a doctor which is related to something in medicine. Okay, so that you need to publish in your entire course of 6 years. So all of these combined, they put up a score in Russian house and they provide you a scholarship. So this was really good for me, and it's a very good opportunity for anyone who is planning even for abroad
या.
or is still studying right now in any of the year, doesn't matter.
या.
If it's before 6th year, So I think it's so good for them so that they
Yeah,
can, like publish something. They can focus on their academics and they can approach and they can apply for the scholarship.
yeah.
So this is my small journey that I went through in past 7 years.
Yeah, no, that's really, and we have to develop ourselves in general, not just academically. Just like so many students have this doubt कि वो रेड डिप्लोमा के पीछे भागते हैं, but they don't know कि बहुत सारे factors. Like if you have good work experience, थर्ड ईयर के बाद में तुमने एग्जाम क्लियर करके तुमने एम्बुलेंस स्कोर प्रमोशन फिर कोई से भी हॉस्पिटल में कराया तो that also gives you some points, right?
Yes, yes, you
Yeah.
are completely right. So let me just give you a very small information here that in all of the colleges in Russian Federation, okay, from the till third year, they have
Yeah.
the preclinical courses,
Mm.
okay, and after that, any student can apply for working in ambulance or in
Yeah.
polyclinic, so this gives you a clinical exposure.
Mhm.
So people say that कि आप जब बाहर जाते हो you don't have like practical skills या practical skills
Exactly.
आपके उतने develop नहीं हो पाते, so that is a kind of a myth.
Yeah.
Actually this is you who is not applying for all of this, but in
Exactly.
fact all of these are available in all of the universities. You
Yeah.
just need to come across, you need to ask your teachers, you need to ask your dean,
Being.
okay कि how can I apply, okay, and they will guide you through the process कि आप कैसे आप like like there are nursing staffs, so first of all you need to have the basic like practical
Yeah.
skills. So it's very good when you work with the nurses, you
Mhm.
learn basic things like for example IM IV, so all
Yeah.
of these injections लगाना, ठीक है, जो basic होती
Good.
हैं चीजें ये सब आपको आता है, like using sphygmomanometer, ओके, ऑस्कल्टेशन वगैरह जो जो भी चीजें होती हैं इस टाइप की चीजें जो है ये बहुत अच्छी चीज होती है कि आप ये सब थर्ड ईयर के बाद क्लिनिकल एक्सपोजर में
Good.
वर्किंग इन एम्बुलेंस लाइक वर्किंग विद इमरजेंसी मेडिसिन, सो ये
Mhm.
सब बहुत ही एक अच्छी चीज है जो आप सीख सकते हो अगर आप रशिया में रहते हो, ठीक
Good.
है। और ये सब चीजें आपको कोई अलग से पे नहीं करना होता है
Mhm.
फर्स्ट ऑफ ऑल।
Okay,
सो दिस
makes
इज
sense.
इन योर, यस दिस इज इन योर करिकुलम। The
Yeah.
only thing that you need to have is like inquisitive behavior. Yeah, you have to be like inquisitive about like मुझे जानना है, ठीक है, मुझे सीखना है। So
Mhm.
then you will come across all of these things in any of the universities.
Yeah, for sure. And if you guys have any confusion इस चीज से रिलेटेड तो मैंने एक रीसेंट वीडियो डाली थी। I'll just कहीं पे तुम्हें वो सर्टिफिकेट शो कर दूंगा बिकॉज आपने तो काफी साल पहले दिया होगा। नाउ यू ऑलरेडी क्लियर एक्रेडिटेशन, दैट्स द टॉप मोस्ट। बट मैंने अब तक एक्रेडिटेशन बिकॉज आई एम स्टिल स्टडिंग इन फिफ्थ ईयर कंप्लीट करके आई विल स्टार्ट सिक्स्थ ईयर, बट आई समहाउ समवेयर शो दैट सर्टिफिकेट। उसमें वो समझ जाएंगे कि कैसे अप्लाई करना होता है वगैरह। So yeah, Dr. Saurabh, let's get into it. I have so many questions because students
Yes,
just
sure.
bombarded questions for you. So we have
Okay.
categorized questions। यहाँ पे कहीं पे हम लोग डाल देंगे कि कौन से सीक्वेंस में कौन कौन से क्वेश्चंस आ रहे हैं जो तुम लोगों को इंटरेस्ट है, विच अपील्स यू। यू कैन डायरेक्टली गो टू दैट सेक्शन, और अगर तुम्हें लगता है कि नहीं ये सेक्शन मुझे पहले से पता है, बिकॉज क्वेश्चंस इतना है पॉडकास्ट बड़ा होगा, हम कितना भी ट्राई करें। If
Sure.
he, Dr. Saurabh will try to
No
explain
worries.
something, if he needs to explain, he needs some minutes. So we won't be like कि जल्दी से बना दिया बस कि बस रशिया 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 सबसे अच्छा रशिया, नॉट लाइक दैट। जो प्रोज है जो कॉन्स है
Yes.
उसके हिसाब से वी नीड टाइम, बिकॉज इट्स नॉट लाइक कि हर किसी को एक ही ऑप्शन सूट करता है। हर किसी के लिए अलग अलग चीजें होती है। सो यू शुड असेस इट। सो विदाउट एनी डिले लेट्स स्टार्ट। So Dr. Tal, as you told about yourself, and now just quickly, if you want to give some perspective, some, your personal review about your 6 years journey as a student and your work process, work life balance, रशिया में your PG everything। अगर कोई बच्चा देख रहा है जो अभी फर्स्ट ईयर में जाने की सोच रहा है या वहां पे है ऑलरेडी,
Mhm.
अगर वो आपकी पोजीशन पे आके आपके जैसे एनरोल करना चाहे, आपके जैसे एक पाथ पे चलना चाहे, तो as per your experience, what are the pros, what are the cons, and what should be the few tips he should always remember that this is much needed in the journey.
Sure, I'll explain. I'll start from the very, like the very first year
Mhm.
story that how I
Mhm.
started my journey. Okay, so like any other student, you need to like, first of all, you need to qualify NEET. That is the mandatory criteria these days that you need to qualify NEET, and then only you can plan for study abroad option. So that is how I also did. Okay, I also qualified my NEET first of all, and then started looking options when I didn't get seat in India. Started looking options for abroad, and then I came across, of course people look for budgetary options, okay,
Yeah.
so I also tried to look something for in the budget. Okay, my budget was also fixed, so I thought that it's better to look for a budget option. So I came across university, okay, and Then I looked forward for more things about the university, like how is the campus, how is the infrastructure, how far it is located from, Moscow. So all of these, like a fresher guy. So I was all looking for like what is new there, this and that. So this is the very first thing. Second thing, when I came here, I noticed that one thing that there is actually no such difference in teaching method. Okay,
Yeah.
to be honest, in theoretical part, okay, first of all, let's talk about the theoretical part. So
Mm.
there is no difference because here also in Russia, most of the colleges, they provide you Indian author books.
Mm.
So you have the books here available in your libraries. So if you are willing, if you want to become a good doctor, you will go through the book. I will not tell anyone any shortcut that go through this video, go through that video. Okay, videos help you a lot, but you should always have a reference from a good book. So that is how I studied, and that is what I recommend to my juniors also in our university, that please have a book. Okay, you keep on, start, because when you read you from, video or somewhere on internet, okay, you just read about a topic.
Mm.
So when you have a reference book, you can parallel, you can just compare it. Okay, आप साइड बाय साइड देख सकते हो कि आप क्या पढ़ रहे हो, कोई टॉपिक मिस तो नहीं हो रहा है.
Mm.
And this way you gather the information in a very proper manner.
Yeah. Collective
So
way.
this is number one. So
Yeah.
always have a reference book
Yeah.
and study. There is no shortcut in medicine.
Yeah.
You have to read the entire theory. Okay,
And
so that is
yeah, and in our libraries, we also get this gold standard books. I remember, कोई से भी books you can get it in the libraries, gold standard ones or bones and सारे anatomically dissected organs. तुम anatomy lab में जाके ले सकते हो. That's you can keep your iPad or your books और उसके बाजू में पूरा एक ट्रे लेके टोकन देके अपना टोकन जैसा आपने 10 आइटम्स लिए. आइटम्स इज अ डिनोमिनेशन फॉर बोन्स या फिर दूसरे ऑर्गन्स. वो लेके यू हैव टू सबमिट इट बैक बट यू कैन डू ऑल ऑफ दैट. सो ये सारे प्रिविलेजेस मिलते हैं. एंड वन थिंग विच आई पर्सनली फेल्ट वाज कि फर्स्ट सेकेंड ईयर से इफ यू स्टार्ट विद दीज ऑनलाइन प्लेटफॉर्म्स, मैरो प्लेटर, बहुत सारे हैं, मेस्ट वगैरह बहुत सारे हैं, then you have a specific knowledge for that specific topic. अगर इनमें if you start very early, then you won't be having that mindset of going through the pain of reading maybe 10 extra pages of that specific topic, क्योंकि जब उसके बारे में ज्यादा पढ़ ही लोगे then it will somehow stuck in your brain, and because there is no set limited set of patience, you need to use your knowledge बहुत सारे अलग अलग situations में. So online, that's for sure कि सिर्फ एक स्पेसिफिक कोर्सेज डज नॉट हेल्प. आई थिंक डॉक्टर नजीब का वो पुराना वाला सब्सक्रिप्शन याद है आपको, जो 140-150 डॉलर
हम्म.
में देते थे. वो फिर भी एक था.
बिल्कुल.
वो था जो मैं कहूंगा कि हाँ, वो हर सेकेंड ईयर में मैंने भी काफी यूज किया था, बट वो वीडियोज इतने लंबे थे कि वहां उससे जल्दी आप बुक से पढ़ सकते हो. तो अगर करना है तो वैसा कुछ यूज करो, नहीं तो प्रेफर कि उसको एक एग्जाम रिलेटेड अप्रोच अलग हो गया और एक नॉलेज के लिए पढ़ना अलग हो गया.
यस, सो दैट इज कि आप जब रशियन, रशियन सिस्टम जो होती है, सो बिकॉज सक्षम यू ऑल्सो नो दिस थिंग, सो इट्स ग्रेडेड इन टू 5 marks. So
या.
when you get 5, it's excellent. 4 is good. 3 is satisfactory, and if you get 2, that means you're failed, and you have to repeat. You have to retake the exam. So this is the system in Russian Federation. So this is a very good system actually, and why I will say good, because they teach you some topic this week and they will take the exam in the next week, upcoming week. Okay, so this way you don't have like a very big material to memorize, to mug up at the very, like, the last moment of the exam, because every week you have to give some examination. So this is how you prepare for the entire topic, or entire, I would say, like a subject. So this is a very easier way to prepare. And next thing, I'll say that regarding practical skills, I'll say from the very first year, we were taken into surgery. Like, we were not having much information what we have to do.
What
First
is
of all,
going
we were
on?
getting acquainted to, हमें उस माहौल के साथ वो acquaintance कराया जाता है कि मतलब how you have to behave, how you have to scrub, how you have to follow the hygiene, proper hygiene जो होता है रशिया में तो बहुत ही ज्यादा follow होता है.
Of
So
course.
ये सब चीजें आपको सिखाई जाती हैं. and then they start teach you something which is like related to nursing. And uske baad फिर then from the second year again they, because it's like a kind of a cycle that you have to go through every year, like for like couple of weeks. Okay,
Yeah.
in the autumn semester also, in the spring semester also. So ये मुझे काफी अच्छा लगा था कि like this is the way like you learn. Okay, theoretical part तो ठीक है, that is you are having a book, you have a teacher who will teach you everything. एंड क्लासेस की ड्यूरेशन बहुत ही ज्यादा होती है टू बी ऑनेस्ट। ठीक है, ऐसा नहीं होता है कि आप जाते हो 1 घंटे में घर आ जाते हो, ऐसा नहीं होता है। वी यूज टू गो एट 8 o'clock इन द मॉर्निंग,
Yeah.
एंड रशिया इज अ वेरी लाइक डिसिप्लिन कंट्री, सो 8 o'clock मीन्स 8 o'clock।
Yeah.
ओके, यू हैव, ठंड हो रही हो बारिश हो रही हो कोई फर्क नहीं पड़ रहा है, यू हैव
बस
टू बी
चेंज
देयर
करके जाना हो।
8 o'clock। एंड देन the class duration was quite long, so like we used to come back and like somewhere near 5 o'clock or sometimes like 6 o'clock. So and the classes were held in such kind of manner, and जो भी theoretical part था, जो भी practical part था, we used to learn. And after completion of third year, so when the fourth year starts, it's all about cycles. Okay, you have to go through departments. Okay, like surgery, then therapy, then ENT, then gynae. So all of these cycles are designed and framed like this way. Like you have to pass through this cycle for like a couple of weeks, like 2 or 3 weeks. Okay,
Depends on
so
subject.
this is how. Yes,
Yeah.
and the best part was that it was not just about the cycle that you're learning, you were having an actual exposure of the patient. So
Yeah.
they were sending you in the department. So that was like we were taken by our teachers, and our teacher used to explain us like what is the clinical case about, because that is very mandatory, because learning from theoretical only books is not helping. So when you see live patients, you notice some symptoms. Teacher used to point out like, okay, this is the clinical picture. Like you will see edema, you will see like soreness, you will see some rash or some pigmentation on the skin, cyanosis, this and that. So this is how we just not read from the book, but we also visualized it in our mind. We saw it by our eyes that okay, this is what we were talking about when we're talking cyanosis. So this way we learned, and this was really good from the fourth year till the sixth year. It was all. Then next moment was for me to give the GOZZ exam. GOZZ exam is the, like a Sudarsvani exam we call in Russian, which is the state exam. It's taken in the Russian medium. Okay.
Yeah.
So first of all, you give the last exam of your sixth year in
Good.
English, but the main exam, which is taken by the Russian body, is in Russian medium. But do not worry, ठीक है, आपको डरने की कोई बात नहीं होती, क्योंकि very from the very first year you have Russian classes. Okay, so you start speaking, like I'll not say like you are a pro level
Yeah.
Russian speaker, but you are a medium level. Okay, and then you understand what the patient is talking, and you have to, from the clinical picture, you have to figure out what's the diagnosis of the patient. So this is what was about like the sixth year. So after giving the GOS exam, the state exam in Russian, then people, those who want to practice in Russian Federation, they have to take the license. As same as like FMG students when they go back to India, so they also take the licensing exam. So that gives you a permit to work and to start treat patients in India. So the same way it's in Russia. So you have to give this licensing exam. And for this licensing exam, there are three levels. Okay, so so I'll just explain it right now. So the first level is like it's like a MCQ based test. Okay, it's a CBT test, computer based test. Okay, so you have like you have like 100 questions. Okay, I'm if I'm not wrong, 100 only. Okay, so you have like on your screen, and you have like it's everything is under camera. So you sit and you give the exam, the first level. The second level is about the simulation center. So simulation center, let me explain you. It's like like there is a room dedicated to one of the department, and in that room everything is designed accordingly. If it is gynecology, either it is ENT or it is ICU or it is a first aid. Okay, so you have to enter into the room and you have to act like you are a doctor who is a working professional, and you have a patient in front of you. You have to see the patient. You have to, there are protocols that you need to follow. Step number one, like you have to enter the room. Step number one is that you have to follow the hygiene. You need to wash your hands. Step number two, you have to walk to the patient. You have to check if the patient is conscious or not. So this is the protocols that you need to learn, and step by step you need to do enact in front of the camera, and there are invigilators sitting behind the glass. There is a glass door. Okay, so behind the glass They are sitting there and they're watching you enacting all of these things and reciting. You have to recite also what you're doing.
Yeah.
So this is about the second level, and the third level is about the clinical cases. So you will get two clinical cases and you have to, like, describe about it, and you have to fix the diagnosis and the treatment. So this is what accreditation exam is about. So in cut short, if I'll say that, first of all, have a reference book with you, because this will give you a very deep knowledge of the subject. Do not do some shortcut, because you have enough time. Like Russian Federation, you have like 6 years course,
Yeah.
so you have enough time to learn these 19 subjects. So I will say always have a reference book, first of all. And second, you can have, any, I'll not say and take any names of the companies, okay, but you can have any, like, plans that are easily available for the PG courses, for the FMG
FMG
courses,
courses.
and for AIMS also. There are like INICT, there's specific videos designed for it. So you can just go through any of the like apps which is available, and side by side you can just, like, when you see something visually, when like somebody is teaching you in, like, like it's like a private tuition basically. So when you study from there, from the most experienced, like, teachers, professors, doctors, so it becomes easy for you to learn something. So I'll say, like, side by side you can use it, but always have a reference book. And accreditation is not something to be worried about. If you have learned properly in the
Yeah.
6 years, okay, and you are a, like a medium level Russian speaker, you will easily clear it. There is no such big hurdle. My friends also cleared, my juniors also
Yeah.
cleared, so I'm really glad when I see them that they have cleared it in the very first attempt. And there is also retake of the accreditation exam when you're not able to. But still, people, those who study in proper manner, they don't find any difficulty.
Yeah, even I'm planning to give this accreditation exam. And this basically you need to just depict a real life situation को depict करना that you are capable of performing the same procedure if you are in
Yes, exactly.
that medical setup. So yeah, for the latest update, as we know, most of the students who will be going, जैसे अब तक so many students used to give this exam, but it was not mandatory for all of us. It was our will. We willingly used to give this exam,
Mhm.
whoever was comfortable with this whole procedure. But now, as of now, students have to mandatorily give this exam. So it is very good that you should have some basic guidelines how you should prepare from the very first year. So these are the basic things, and you'll get to know about it. That it's not very difficult. You just need to be a little, concerned about the exam. Not like never see a patient. I see so many students who does not get the most out of universities. Universities, they try to provide everything they can, but at the end of the day, it totally depends on student how he perceives the information. Is he actually willing to get up early,
Yeah,
go
I
for
agree. I agree
surgery,
completely.
build up personal relations with doctors? I always say this, that no country gives you something special, or any, they won't be giving you out of the box anything. There's nothing. I cannot, like, there's no way we can just say, okay, this one university you'll get everything. It's not possible. It depends how you perceive the information, if you build proper relations or not. Like, of course, you are doing a lot of things there, so I know you personally, so I know that how you build your relations with your teachers, your doctors, your deans, and everything, how you got enrolled in so many different things. So maybe someone in the same setup, in the same group as of yours, was not able to achieve all this. So it totally depends on how you perceive the information all over the years. So
Yeah, I would completely agree. Like, like your because once the, your professor, your doctors, they see that the student is interested, and
yeah,
they ask their doubts, and they ask for, like, can I assist in surgery? Even they take you for the assistance in the surgery. Okay, they take students. Okay, it's just depends on your, like your like how willing you are
yeah,
to learn things. That is all about that. Okay.
yeah.
So everything is available. It's just you need to knock the doors.
Mhm.
You just need to knock,
Of
and you
course.
need to just wake up. You need to
Yeah.
wake up. Russia is like wake up.
वहां पे
Yeah,
कोई
every morning they give you a wake up call.
of course they won't be
The favorite
coming
term,
like this.
Atra Bodka. Or Atra Bodka
But
will wake you up.
फॉर श्योर वो लास्ट में जब पता लगता है ना, अरे यार ये कब मिस हो गया, फिर मैम कैन यू प्लीज क्लियर इट, शील बी लाइक नो वन अस्त्र बोट का वन डे, मैम प्लीज कैन यू डू टू, बहुत दो
Yeah,
guys.
yeah. They do not compromise with the quality of Atra Bodka.
Yeah,
Atra Bodka, guys, I'll tell you,
बिल्कुल
this is
बहुत
called
सही.
extra classes in Russian.
Yeah,
They do not even compromise with the extra classes. They will just
Not
fix
at
you
all.
like, okay, one day, one topic, you have to
Yeah,
come, you have to learn, and you have to give the exam. That's it.
yeah,
You can, if you like miss like two, three topics and you want to do it in a day, never,
yeah.
never keep it till the end day because it is
Of
a
course.
nightmare then.
ऑफ कोर्स एंड एक्चुअली इट्स गुड, नहीं तो वहां पे हमारे ऊपर कोई सर्विलेंस तो बिल्कुल नहीं होता। इट्स एक्चुअली काइंड ऑफ
बिल्कुल।
सर्विलेंस दैट कीप अप टू द पाथ। अदरवाइज यू नो majority of students they're gonna end up just forgetting everything they ever
No,
studied.
I don't think like it makes a difference while you are in India or while you're in Russia or
Mhm.
in any other country of the world. Everybody
Yeah,
wants to relax in the morning. That is
of
what I
course.
know. Okay, that is what even I want to do. Even I wanted to, relax. Nobody wants to get up in the morning in the cold winter
Yeah.
and then walk for the classes. So nobody likes to do that. But still, this is a really good way, as you said, that it's like a kind of a guardianship. Okay, the
Yeah.
teacher, like the system provides a
Mhm.
kind of a surveillance on you, like that you will perform well at the end
Yeah.
of day, even wherever, whichever university you are, graduating from,
Mhm.
will feel proud of you once you are into such kind of a sphere where you are practicing as, like one of the reputed cardiologist, nephrologist, or ophthalmologist, doesn't matter. They will feel proud and they'll say that, okay, our alumni are working in this particular hospital. So they also want that you learn something really good. Your
Mhm.
teachers, especially your teachers, your doctors, still today, I connect with my teachers from the very first year, and they are
Yeah.
right now in many other universities. They say that we are really proud of you. I feel so good about it,
Yeah.
my teachers, like they were like my kind of parents. Okay, and I feel the
Yeah.
same like when my parents are saying something good about me.
Yeah,
So
that's true.
this is really good to hear.
या एंड ऑफ कोर्स आई फील कि जितना मेरे को रेफरेंस है इंडिया का और जितना रशिया का, पर्सनली फॉर मी, इन रशिया यू कैन बिल्ड इवन स्ट्रॉन्गर रिलेशंस विद योर टीचर्स, क्योंकि वहाँ पे वो इतना बहुत ही फ्रेंडली, बहुत ही इजी वे में अप्रोच करते हैं स्टूडेंट्स को। इफ यू वांट सम फेवर्स दे आर विलिंग टू डू एनीथिंग। दे कैन दे दे टेक एन एक्स्ट्रा स्टेप ताकि बच्चे को समझ में आ जाए। एंड सिंस अगर थोड़ी बहुत आपको रशन आती हो ना, थोड़ी बहुत भी आती हो, और अगर टीचर को एफर्ट्स शो करो, तो दे आर फ्लैटर्ड, दे जस्ट दे इवन सिट देयर 1 hour एक्स्ट्रा टू एक्सप्लेन समथिंग टू यू, जो कि बहुत रेयर होता है। सो ओके डॉक्टर, थैंक यू फॉर एक्सप्लेनिंग द ग्रेडेशन एंड द फ्रेमवर्क कि बच्चों को क्या याद रखना चाहिए क्या नहीं। बट वन थिंग दैट एक्चुअली फैसिनेट्स अ लॉट ऑफ स्टूडेंट्स, और जो एक्चुअली मेरे को भी काफी फैसिनेट करती थी, कि हाउ टू लर्न रशियन लैंग्वेज। हर एक का अपना अलग तरीका होता है। आप कुछ टिप्स दे सकते हैं फॉर स्टूडेंट्स जो कि अकेडमिकली, जिनका एम है कि चलो मेरे को आना इंडिया ही है, या फिर मेरे को अलग कॉम्पिटेटिव एग्जाम्स देने हैं फ्यूचर में, बट स्टिल आई वांट कि हाँ, मेरे को इतने रशियन आए कि मेरे को वहाँ पे क्लिनिकल एक्सपोजर अच्छा मिले, सारे एग्जाम्स वगैरह मैं अच्छे से दूँ, एक्रेडिटेशन करूँ, वहाँ पे जॉब करूँ पार्ट टाइम फोर्थ फिफ्थ सिक्स ईयर में, जैसे हमें पता है कि इसको रैपर मोश में और बाकी जगह बहुत ऑप्शंस होते हैं। और मेरी पर्सनल लाइफ भी काफ़ी सॉर्ट है, क्योंकि किस कंट्री में आप रह रहे हो उस कंट्री की लैंग्वेज, तो इट्स लाइक वेरी इंपॉर्टेंट, नॉट जस्ट फ्रॉम स्टडीज परस्पेक्टिव academics, but in general life as well. So what was it for you? आपने क्या करा, आपने कैसे उसको, क्योंकि हम लोग एक दो प्रोफेशन नहीं हो सकता है, हम लोग वहाँ नॉवेल्स तो लिखने गए नहीं हैं। हम लोग को नॉवल, अपना एजुकेशन बेस्ट मिले, हमारे लिए कोई प्रॉब्लम ना हो, वो चाहिए। सो व्हाट वुड यू रिकमेंड ऑन दिस?
So first of all, let me tell you that no, like any other language in this world, uh, it's mere language. Okay, first of all,
Yeah,
it's just a mere a language. It's not about knowledge. Okay, it's a language. It's not a knowledge. Okay,
yeah,
so it doesn't matter कि आप किस language में पढ़ते हो, ठीक है? Even if you able to grasp things in हिंदी, ठीक है, आप हिंदी में याद कर लो। आपको तमिल में आती है, आप तमिल में याद कर लो। कन्नड़ में समझ में आती है, कन्नड़ में पढ़ लो। ठीक है, इंग्लिश में आती है, इंग्लिश में समझ लो। रशियन में आती है, रशियन में समझ लो। ओके, दैट इज वन थिंग। लैंग्वेज इज जस्ट अ लैंग्वेज, इट्स नॉट नॉलेज। वो कहीं से भी नॉलेज का कंपैरिजन नहीं है, ठीक है? आपको पता होना चाहिए डोज में क्या, आपको कौन से ड्रग्स देने हैं, कौन सी मेडिसिन देनी है। दैट इज व्हाट पीपल वांट टू नो। पेशेंट को क्या चाहिए वो आपको पता होना चाहिए, ठीक है? सीइंग द क्लिनिकल पिक्चर, दैट इज नंबर वन। नंबर टू इज दैट, okay, yes, you should, I would recommend to all the juniors, upcoming juniors, ki yes, you should learn as I told, not, you should not be a pro level Russian speaker, but a medium level. Why? There is a good question. Why? Because आप जब पेशेंट से इंटरेक्ट करोगे, क्योंकि रशियन फेडरेशन में पेशेंट्स जो हैं, वो सारे पेशेंट्स तो इंग्लिश में बात करते नहीं है, फर्स्ट ऑफ ऑल, ठीक है? सो हाउ विल यू अंडरस्टैंड देम प्रॉपरली कि उन्हें क्या प्रॉब्लम्स हो रहा है? ठीक है, अगर वो रशियन में बता रहा है कि मुझे घोटने में, खाना को घोटने में मुझे दिक्कत हो रही है, ठीक है, या
yeah,
मुझे डायरिया हो रहा है, या मुझे यूरिन नहीं पास हो रहा है, कोई भी कंप्लेंट वो कर रहा है, ठीक है, हाउ विल यू अंडरस्टैंड अनटिल अनलेस यू अंडरस्टैंड द लैंग्वेज, जिस लैंग्वेज में वो बात कर रहा है। अदरवाइज, कि मुझे तो नहीं लगता कि देर इज अनदर नीड फॉर दिस apart from having doctor patient conversation. Of course, if your personal life is there, okay,
Yeah.
and you're looking for a personal life, of course, learn Russian
Yeah.
language, okay, that might be helpful for you somehow. But being in a
Yeah.
profession, you should have a doctor patient relationship, like a conversation, not relationship, doctor patient conversation. So sorry, cut. So you should have a doctor patient conversation. Okay. So doctor patient conversation के लिए you have to talk, both of you have to talk in the same language. आप दोनों को सेम लैंग्वेज में बात करना होगा और एक दूसरे को समझना होगा, क्योंकि यहाँ पर थोड़ी सी मिसअंडरस्टैंडिंग की वजह से हो सकता है कि आपकी डायग्नोसिस को अफेक्ट हो जाए, ठीक है।
Yeah.
So this is why you should learn Russian language. Okay, how to learn? Now, like when I came to Russia, I started with YouTube. YouTube पे 1,000 आजकल तो
Same.
आप लाइक कोई भी लैंग्वेज उठा लो, स्पेनियल उठा लो, नेमेस्की उठा लो, जर्मन जो भी है, मैंडरिन चाइनीज लैंग्वेज जो होती है, आप कोई भी लैंग्वेज उठा लो, आजकल तो सारे के सारे यूट्यूब पे अवेलेबल है वीडियोस। एंड पीपल आर, लाइक पीपल दोज हु आर सिंगिंग दीज डेज, दे आर एक्चुअली सिंगिंग in so many languages they don't even know about. Okay, so this is like, just listen, like you listen some songs, listen some, some podcasts, listen to some people, watch movies. That is how I find is the most interesting and funny way to learn a language. Okay, to develop interest also, and to have
Yeah.
a good vocabulary. Okay, this is number one. Number two, try to have some medical terminologies in Russian, because sometimes when you are writing clinical, cases, so you will come across many words like, okay, so that is written in Russian, and that is not in Latin also. So Latin is a dead language, not no longer spoken. But in medicine, we use Latin because
Yeah.
it's universal. So everywhere people understand when you speak Latin. Good thing is, रशिया में आपको फर्स्ट ईयर में लैटिन लैंग्वेज सिखाया जाता है.
Yeah.
सो वेन एवर यू गो अब्रॉड, वेन यू वर्क इन इंटरनेशनल स्फीयर, इवन इफ यू डोंट नो देयर लैंग्वेज, यू कैन स्पीक द टर्म ऑफ लैटिन एंड पीपल विल अंडरस्टैंड. ठीक है, ऐसा कोई नहीं है कि कोई लैटिन नहीं समझ रहा होगा डॉक्टर, ठीक है, इवन इन इंडिया ऑल्सो दे अंडरस्टैंड, एवरीवेयर दे अंडरस्टैंड, ठीक है। सो लैंग्वेज के लिए फर्स्ट ऑफ ऑल आपकी क्लासेस होती ही हैं, रशियन फेडरेशन में तो हर वीक क्लासेस होती हैं, नंबर वन। नंबर टू, आपका अपना इंटरेस्ट डेवलप करना होगा आपको। अगर आपको कोई चीज़ सीखनी है तो आपको खुद का इंटरेस्ट डेवलप करना होगा, वॉच समथिंग रिलेटेड टू इट, and you'll start learning faster. That is all. And you don't have to read like novels to, like have a big vocabulary, nothing. You just need to
Yeah.
read something in medicine that will aid your profession. That's it.
Yeah.
This will
And
help you.
of course, and तुम लोग की क्लास भी होती है फर्स्ट सेकंड थर्ड ईयर, तो पूरी क्लासेस होती है, एंड द फोर्थ ईयर फर्स्ट सेमेस्टर यू आल्सो गेट मेडिकल टर्मिनोलॉजीज। इतना टाइम मिल रहा है, दैट्स मोर देन इनफ, लाइक एक लैंग्वेज के लिए तो बहुत ज्यादा है। और अगर तुम्हें फिर भी नहीं समझ आ रहा है, सो जस्ट गो चेक आउट माय चैनल। मेरे चैनल पे सबसे ज्यादा मैं लैंग्वेज फोकस्ड वीडियोस ही डालता हूँ एक्चुअली, बिकॉज आई थिंक कि वो एक कम्युनिकेशन गैप है। नॉट देर आर नो इंडियन जो कि ये काफी बता रहे हैं। एक पॉडकास्ट भी है, पॉडकास्ट देखो, और फ्रेमवर्क है। बिकॉज मेरा केस थोड़ा कॉम्प्लिकेटेड था। आई लर्न रशियन लैंग्वेज थर्ड ईयर में स्टार्ट करा मैंने, उसके बाद में 6 से 8 महीने में सीखा था। तो ऑब्वियसली अगर मैंने स्टार्ट लेट करा, 2 साल छोड़ा, तो मेरे को नॉवेल्स भी पढ़नी पड़ी थी बहुत सारी। स्टैलिन, आपकी सिटी की तो मैंने काफी सारी चीजें पढ़ी है। और उसके अलावा
Mhm.
नॉर्मल बुक्स और नेटफ्लिक्स वगैरह, बेस्ट सॉन्ग्स एंड नेटफ्लिक्स, वो अपने आप में काफी कुछ सिखा देता है। यू डोंट एक्चुअली नीड टू बी very proficient and specifically go with the regime of learning a language. You should be just able to communicate, that's it। एक means of communication की तरह से language को approach करें तो फिर वो far better रहेगा। and okay डॉक्टर, and one more question जो कि actually अभी डिसीजन बनाने के लिए ना बच्चों के लिए थोड़ा इंपॉर्टेंट हो जाता है, कि अब आपको क्या लगता है। If I want to ask you, okay, sir, explain your work-life balance. What do you do? What is your like total regime of the day, and how do you feel about it? What you learned from Russia, and what are the things that kept you going there, like going back to Russia? And what was the appealing thing? There must be something. Work-life balance हुआ, अलग-अलग चीजें हुई. So what's your take on this?
Okay, so first of all, on this point, I'll tell you that I'm an international department officer or specialist in State Medical
Yeah.
University. So I'm currently working in
Mm.
Russia as an administrative service.
Yeah.
So this is one part of my life. Another part of my life, as I told before, that I'm pursuing my clinical residency and I'm in the second year of radiology right now. So this is the another part of my life. And
Yeah.
there comes like my personal life, where there's not only just part for a personal sphere, but also for my personal studies. So, to be honest, um, you have to learn to manage your things within a frame of 24 hours. Okay.
Yeah.
At the end of the day, you have to learn. Okay, this is a skill that you have to acquire, because tomorrow when you will be working in like a hospital or somewhere, you will face the same issues. If you're not facing it now, you will face it later in your life, but you will face it today, tomorrow, doesn't matter, you'll face it. Because tomorrow you will be working in a hospital, then you will having your personal life, your family or something. So it's better to learn from the from an early age to balance your personal life with a professional life. For me, as an administrative job, we have over more than 2000 plus international students, those who I'm dealing per day.
Yeah.
Okay, I don't know who is coming. Not everyone is 2000 people, all of them are coming to my
Or,
office every day, of course not, but how many people are coming? I have to listen to them.
yeah.
I have to create a solution for their problems, okay, if possible, okay,
Yeah.
and I need to address their problems properly. So this is like, it doesn't, it's not like कि आपने कुछ सुना and then you forget it at the moment the person leaves your office. No, it doesn't happen like that.
Yeah.
So it stays in your mind. Sometimes it happens like I say like, okay, today is not possible, maybe some due to some reason. Please come tomorrow. So till tomorrow, my mind, a small part of my mind is engaged. Okay,
Yeah.
so this will keep on happening in your life. Okay, it doesn't matter where you are,
Mm.
in which part of your life you are living, but it will keep on happening. But this is how in a system you start learning, you start adapting to the system. So work life balance, you will have to learn at some point. Okay,
Mm.
people will say, okay, okay, मेरे को ऐसा, मेरे साथ ऐसा नहीं होगा, कुछ नहीं
हाँ,
होगा, होगा, सबके साथ ही
आपके साथ
होता
तो
है,
होगा।
ठीक है। एंड पीपल, कोई भी ऐसा सीख के नहीं आता है, लाइक
हम्म,
नोबडी इज बॉर्न, लाइक ये सारी चीजें सीख करके कोई नहीं पैदा हो रहा था कि, बट आप धीरे धीरे सिस्टम में रहते रहते यू स्टार्ट अडेप्टिंग टुवर्ड्स द सिस्टम,
हम्म,
एंड यू स्टार्ट डेवलपिंग स्किल्स कि आपको टाइम मैनेजमेंट कैसे करना है। सो
हम्म,
इट्स ऑल अबाउट टाइम मैनेजमेंट कि 24 आवर्स सबके पास ही 24 आवर्स है, बी प्राइम मिनिस्टर ऑफ आवर कंट्री, okay, be president of the country,
हम्म,
or be a normal person, everybody is having the same 24 hour regime, and उसमें
हम्म,
ही सारी चीजें सभी को करना होता है। तो you have to earn your bread, you have to give time to your family, your personal life, and you have to work something, okay। So
हम्म,
सब कुछ आपको 24 hours, so you have to learn at the end of the day। So my work is like good, okay, I feel sometimes like I feel happy when I'm helping students, I feel very happy in the evening that okay, my day went well, I was able to help everyone. So when I went go to
हम्म,
the hospital, I don't bring everything, like on like for example, like I don't bring my administrative work on my hospital timing. I do
हम्म,
not I have already mentioned to the people that if it is urgent, then for sure contact me at this duration also, but this time is dedicated to my studies and this time is
हम्म,
dedicated to my hospital work. So I do not keep anything in my, when I go to the hospital, I just try to see the patients, I just
हम्म,
try to see the whatever my case is about, or whatever the professor doctors are trying to teach me, I just focus on that. I do not bring on the table like, okay, there was some problem in the university or there was a problem in the, I do not do it. Okay, so don't mix up your life. Okay, do not mix up your
हम्म,
personal professional life. And then even if you're having two kind of profession, do not mix them with each other. That again creates a very big problem. So this is
exactly.
how I managed,
Yeah,
and
that's,
I would recommend to everyone.
you
So
know,
successfully, I'm, like people ask me, how are you these days? And I say that Jivoy. Jivoy means alive.
I like it. Yeah.
So this is how
Yeah, like,
I react to when
of
people
course.
ask me like, how are you managing? So
पर फर्स्ट ईयर से स्टूडेंट्स को अडाप्ट करना तो सीखना ही पड़ेगा, बिकॉज अलग कंट्री है, सारी
बिल्कुल
चीजें अलग है। फर्स्ट ईयर से ही कर लोगे तो इट विल बी फार बेटर, बिकॉज एकदम स्टार्टिंग में जैसे नहीं होता है कि हम तो स्विच में आते हैं, नर्सरी जूनियर से डायरेक्ट फर्स्ट क्लास में आते हैं, सो यू नीड टू अडाप्ट। तो वैसे ही अगर इसमें अडाप्ट कर जाओगे तो इट विल बी फार बेटर। एंड ही इज इन्वॉल्व इन लॉट ऑफ थिंग्स, बट बिकॉज वी ट्राई टू कीप इट वेरी सिंपल, तो उनसे मैंने स्पेसिफिकली रिक्वेस्ट करी थी दैट ही डोंट गेट इनटू द यूनिवर्सिटीज, बिकॉज हमारी बात सुन के ना बहुत बहुत लोग ब्लाइंडली ट्रस्ट करेंगे। आई नो दिस फॉर श्योर, सो आई बिलीव कि ये थोड़ी हमारी रिस्पॉन्सिबिलिटी हो जाती है कि हम रैंडम नेम्स, हो सकता है कि एक यूनिवर्सिटी किसी के लिए बहुत अच्छा है, किसी के लिए खराब है, या अब्रॉड ही किसी के लिए अच्छा है, अब्रॉड ही किसी के लिए खराब है। तो सर नाम लेगा, मैं मे बी उसे बीप ही कर दूंगा, मे बी नहीं करूंगा। अगर नहीं कर रहा हूँ तो मैं इंटरेस्टेड है, ठीक है, अच्छी है, मुझे भी पता है, इन्हें भी पता है, बट सोच समझ के देखना सारी चीजें। यू शुड बी यू शुड हैव प्रॉपर रिसर्च बाय योरसेल्फ, एंड आफ्टर दैट प्रोसीड विद एवरीथिंग। डोंट बी लाइक, बिकॉज वी आर ट्राइंग टू गिव some genuine facts about it, but just imagine in the same situation if someone have some incentives of popularizing something, then it's very difficult for students to differentiate between the two groups of individuals. So नहीं समझ आया ना, अगर तो वापस बता देता हूँ, देख के जाना समझ के जाना, दैट्स इन शॉर्ट। और नाउ वन क्वेश्चन जो कि बहुत सारे पूछ रहे थे कि भैया रशिया वाला तो समझा दिया, डॉक्टर सौरभ ही इज ऑल्सो इन्वॉल्व कि वहाँ पे वो सारी चीजें कर रहे हैं, बट अगर रशिया जाके मेरा प्लान बना कि चलो मेरे को नीट पीजी भी देख के रखना है, रशिया का भी ऑप्शन इज वेरी वेरी गुड इफ आई फील आई वांट टू लिव देयर, बिकॉज पर्सनली रशिया इज वेरी वेरी डेवलप्ड। वहाँ के अलग प्रोज है जो कि किसी पार्ट ऑफ वर्ल्ड में नहीं मिल सकता। बट अगर ऐसा कोई बच्चा है जिसको ये डाउट है कि आई वांट टू कीप माय ऑप्शंस इवन मोर, like kind of keep USMLE, PLAB and other options as well for my future post graduation, तो एक जो मेथड आता है ना कि रशिया से तो कर ही नहीं सकते, तुम्हें कोई लेटर ऑफ रिकमेंडेशंस नहीं मिलेंगे, रिसर्च प्रोग्राम्स नहीं मिलेंगे, यू वोंट हैव एनी ऑफ को करिकुलर एक्टिविटीज जो कि तुम्हारा सीवी डेवलप करने में हेल्प करे। सो यू पार्टिसिपेट इन सो मेनी अदर को करिकुलर एक्टिविटीज, इन डिबेट्स, इन रिसर्च वर्क्स, यू कैन गेट a good bunch of letter of recommendation, I know। जो आपको डॉक्टर्स यू आर इन टच, दे आर pretty good, if you get a letter of recommendation from them you will have a very strong this CV for PLAB or USMLE ECFMG certifications। So can you give a brief about this, short brief कि क्या possible है क्या नहीं?
Okay. Okay, first of all, see, everything is possible. Okay,
Yeah.
so if you are just dedicated, okay, if you are just having the right approach towards a thing, you will for sure you will achieve it. That's not a very big deal. Okay, so that is number one. Number two is that from our university also, my seniors they cleared PLAB. Okay, and they are currently pursuing, and some of them have already completed. Some
Yeah.
of them are in Germany also, and some of them like have flight to many other countries, and they were pursuing their clinical residency or some PG courses. Okay, some non-conventional, some even chose non-conventional pathways also. They are into um, in India, what do we call that? PSM. So they are into
Mhm.
PSM also. Okay, so they are working in US also, UK also. So it's not a big deal. It's about the right approach that
Yeah.
and the right clear mindset that what you want to do, because medicine all over the world is same. It's not going to change if the bones are 206, so it's 206 all over the world. Okay, so nothing is changing. Okay, the basic fundamental of the medicine
Yeah.
is gonna be same. Yes, of course. Many research paper come up very frequently, and day by day things are evolving. Yes, of course, there will be many things changing, but it's just like a very small part of the story that is changing every day. But most of the things are constant, okay, and it's uniform all over the world. So people are clearing exams, okay, even in Russian Federation when they are pursuing their MBBS course, which is known as Lichebny or general medicine.
Mhm.
Even after that, people who are dedicated, they start giving the USMLE step one from the the penultimate years. Okay, they start giving these exams, and they appear and they really clear it. And after going back from here, they clear the FMG and they do the internship, and then they continue start looking forward for other options in
Yeah.
other countries. And they do achieve it. So I don't think there is nothing there's no thing like a doable thing. So it's not like that. It's doable. So you can do, but just have the right approach and the right proper guidance. That
Yeah.
is what I will say.
Yeah, that's true. But all this procedure, it mostly depends on your capabilities. जो भी तुम्हें इस तरह से, there is nothing like this. Okay, having a decent, good university, I think gives you better education that directly affects. And second, it helps you in clearing the ECFMG verification, getting the enrollment ID in a smoother way. But अपार्ट फ्रॉम दैट ऐसा कुछ भी नहीं है कि एक यूनिवर्सिटी कोई सी ऐसी हो जाएगी, बिकॉज आई हैव सीन सो मेनी स्टूडेंट्स हैविंग दिस डाउट कि भैया कोई तो हमें एक्स वाई जेड एजेंट एक्स वाई जेड ये बोल रहा है कि यहाँ चले जाओ, यहाँ से तो यूएसएमएलई ऐसा क्लियर हो जाएगा, यहाँ से प्लैब ऐसे क्लियर हो जाएगा, यहाँ से बच्चे जर्मनी जाते हैं। ऐसा कुछ नहीं होता, जिसको जाना है वो वहीं से भी चले जाता है। दैट्स फर्स्ट थिंग। एंड सेकेंड, द ओनली लिमिटेशन यू गाइस गोना हैव इज तुम्हारी खुद की उस चीज के साथ में कंसिस्टेंसी। बिकॉज फर्स्ट ईयर में एवरीवन वांट्स टू डू यूएसएमएलई, सेकेंड ईयर में एवरीवन कम्स ओके चलो प्लैब कर लेंगे, थर्ड ईयर में दे आर लाइक ओके चलो एफएमजी कर लेंगे, फोर्थ ईयर में लाइक नीट पीजी फर्स्ट, देन दे आर लाइक ओके चलो एफएमजी तो कर ही लेंगे, और सिक्स्थ ईयर आते आते दे आर लाइक चलो जो हो रहा है वही कर लेंगे। सो That is the most important thing. Apart from that, there is nothing like you need some specific guidance या फिर कोई अलग से ही out of the box चीज कि वो करना जरूरी है. So be aware of that. And what else? We covered up all of the topics, and now, as per the guidelines, there are the main 2 points. First, we talked about the accreditation and everything, and there was a point that you should have uninterrupted internship as of the whole 12 months, and not like the procedure, which is as of now, we do 2 months of internship every year. So it
Mhm.
accounts for 1 year, but it's not continuous. So अगर जो ये एफएमजी के लिए एफएमजीज के लिए जो भी अभी गाइडलाइंस बनी है कि हाँ तुम्हें 1 साल की पूरी इंटर्नशिप करना जरूरी है. सो व्हाट इज योर टेक? आपको एडमिनिस्ट्रेटिव के बारे में पता है, आपको पता है प्रोसीजर्स क्या होता है, आपको पता है सब्जेक्ट्स का गाइडलाइंस क्या होती है, कौन सा सब्जेक्ट कहाँ तक
Mhm.
होता है. सो अब जो जूनियर्स आ रहे हैं उनके लिए क्या है पॉसिबल ऑप्शन? ऑफ कोर्स वी आर नो वन टू डिसाइड कि यूनिवर्सिटी
Mhm.
कैसे हैंडल करेगी, बट एज पर यू इन माई नॉलेज is the most accountable person I can ask this question, because 90% of the people, they're talking bullshit, to be honest. They just make up stories by themselves and no one have a proper explanation for that as of now. So please, can you give the best solution as per you?
Okay, Saksham, first of all, number one, rules and by set by NMC body,
Mhm.
okay, so they are changing, okay, very frequently, okay. So please keep on checking the official website, okay.
Yeah,
Please provide a link on your video
yeah, I'll definitely
caption so
provide
that
them.
people, yes, people
Yeah.
go through that in the upcoming students, they can open that link and read it, okay. So number one is that. Number two is that you should not break any of the rules which is mentioned, like right now, for example, like transfer students are
Mhm.
not eligible for giving FMG. I'm saying it on
Mhm.
camera, but this is what will happening. If tomorrow something changes, I am not aware of.
Yeah.
Okay, guys, then I'm sorry if something has changed now also today also. I'm not really aware. But this was the rule, okay, that you should not change your university. You should stay in one university. You should complete your education.
Mhm.
Next thing is that yes, systems are changing, and even Russian Federation is ready to adapt with the system that has been asked by the like the Medical Council of India.
Mhm.
So they also, like before it was like 6 years of education completely, and then every year you will have a certain period of internship, like a
Yeah.
kind of internship period, which is like a practical session. But right now, like the last year, which is the sixth year, okay, the ultimate year. So they have dedicated this year for complete internship, okay, you
Yeah.
working as a professional in a professional setup in a hospital, so to gain better practical skills.
Skills. Yeah.
So the goal is to the goal is to like to develop good practical skills in you. That is what the goal is about, okay. And nothing you have to worry, first of all,
Mhm.
okay, whatever the changes is, because this is changing. Like I was not having this similar kind of thing, okay.
Mhm.
For example, I studied some subject in the third year in the first semester. Right now they have brought it in the second year, second semester, okay.
Yeah.
So okay, yes, the subjects are like getting a bit early or a bit late,
Mhm.
okay, but doesn't matter. In the entire 6 years of education, they are going to teach you each and everything,
Yeah.
like all these subjects, okay. Then you don't have to worry about anything, because teachers are going to teach you, so they cannot like just do like this a snap and then the book is finished. It doesn't happen like that. They will take proper classes, they will go through the topics, and then you will have enough information about the topic, and then of course you have to do your self study. So you don't worry about anything, okay. Whatever things change, do not be too much involved in this thing, what is changing today, what is changing there, okay, and then get worried about everything. No,
Mhm.
a person who is sitting beside you, okay, in your class and studying with you, and he is dedicated and is focused, he will for sure clear FMG also, get a
Mhm.
NEET PG seat also. Okay, maybe an ICT, NICET
Yeah.
seat also, and maybe he'll get a, like he will clear PSMLE, PLAB, or AMC anywhere. Okay,
Of
so it's
course.
just about your right approach. Okay, do not put so many things, like because there is, because of the mass media and this and that, people talk about a lot of things. Okay, that you have to worry about this, you have to worry about that, but in fact when you go into the system you start understanding. For me also, like I'll
Mhm.
tell you like how were you were like in seventh standard, for example, you were in seventh standard when you used to see the book of the eighth standard. Oh my God, what is this? I'm not able to understand.
Exactly.
As soon as you complete your eighth standard, you're like, what the, like
For
what it
ninth
was like,
standard.
how it was nothing. It was so easy.
Yeah.
Now the ninth was. So like this happens in the real life also. When you come across something, then that thing becomes easy and
Mm.
it's understandable for you. That you just keep on listening from people that will make you feel like, it's very complex. You will not be able to understand it properly, and maybe some people will misguide you even. Okay, not everyone. So it's better always to read by yourself what
Mm.
is mentioned on the website, okay,
Yeah.
by the Medical Council of India. So please
Mm.
refer that. Please do have a look over there
Mm.
and read what is mentioned. That is my recommendation.
Mm.
And do not worry, just focus on your studies from the day one when you enter medical school. Do not think like, okay, fine, 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 FMG is there or NEET PG is there. I'll complete 6 years of my education and then I'll start preparing for India. I'll start preparing for here.
Mm.
No, do not do that. NEET, FMG exams are changing. Okay,
Yes.
FMG exam is no longer a one line question
No,
exam.
not at
Okay,
all.
it's changing. It's a NEET PG paper actually. It's
Yeah.
getting more difficult. Not difficult, I'll say, but it's getting more and more practical based.
Yeah.
Like theory,
It
not less
collectively
theory,
asked
but
from
more
students.
practical, yeah, connective. You need to
Yeah.
have a proper grasp over your theory and your practical so that you can
Mm.
combine and use the knowledge because they want like good doctors.
Yeah.
So it's a very good approach actually to have good doctors. That is what we need right now in a
Yeah.
country which is growing. We need is good doctors for our country to even develop more and more.
Mm.
So my recommendation to everyone, to not waste time. Start your first day, like I like take it seriously first of all and start from the very first day
Mm.
to have this, journey of gaining more and more knowledge and
Knowledge.
experience.
Yeah.
That will be like enough for
Ultimate.
you to graduate with a degree which has a meaning. Okay, it doesn't matter you receive a Krasny diploma, you receive a blue diploma, what Krasny means red diploma.
Mm.
It doesn't matter. The matter is like how much you have in your head, how much you
Mm.
have in your brain, okay, how much you know, how much can help you in your real life with a patient. That is what medicine is about here.
Yeah.
Okay, so just focus on your studies from the very day one. That is all you are needed, and you will not face any difficulties in any of the exams, be abroad, be India, nothing. I've seen my seniors, they have cleared so many exams. Some people have even cleared UPSC, like there is a specific
Yeah.
section for, like clearing
UPSC.
like civil services and medicine
Yeah.
also. Many people have even cleared that from our university. So it's just doable. It's
Yeah, of
just you
course.
need to have the right approach.
Yeah.
So I think all the best to the upcoming juniors. I hope
Yeah.
so. This video they will find somewhat,
Yeah. Usable. Yeah.
understandable, yeah, usable, and they will grasp something from this.
Of course.
Good
And
advice I'm trying to give to them.
of course. And the most important thing you should grab is कि procrastinate करना बंद कर दो. I have seen so many
Yes.
students and students जो मैं तो खुद को भी इसमें fall in करूंगा because शुरुआत में कैसा होता है ना I was so messed up. I used to think everything about USMLE. I used to think everything about PLAB exam, NEET PG. In my head, I was like, अच्छा मैं यूएस जाके ये स्पेशलिटी चूज करूंगा, ये वाली स्पेशल रखूंगा, everything like this. And then I realized कि वो प्रोक्रेस्टिनेशन की वजह से आई एम नॉट पुटिंग द मेन एफर्ट्स इन स्टडिंग जो कि एक्चुअली सबसे ज्यादा यूजफुल है बिकॉज ओनली योर प्रिपरेशन एंड योर नॉलेज विल मेक द बिगेस्ट डिफरेंस आई हैव सीन apart after that I've seen so many students making this procrastination कि हम ये भी करेंगे ये भी करेंगे ये भी करेंगे थर्ड ईयर में ये एग्जाम फोर्थ ईयर में ये करेंगे फिफ्थ ईयर में ये एग्जाम दे इवन प्लान आउट किया अच्छा हम तो फिफ्थ ईयर के एंड में क्लिनिकल रोटेशंस के लिए चले जाएंगे शिकागो में बिकॉज शिकागो में इजीली एक्सेप्ट कर लेते हैं शिकागो एंड मल्टीपल सिटीज बट एक्चुअली में जो ज्यादा प्लानिंग पे ध्यान देता है दे एंड अप losing a lot of time that is actually useful for preparation. Like I have seen so many students जो यूएसएमएलई के पीछे पूरे पागल है. I used to ask, okay, they know step one, step two, step three, first aid जान लिया. And just ऐसे ही अभी कुछ टाइम पहले भी I was talking with someone तो मैंने ऐसे ही पूछ लिया कि okay तो what's your take on Dr. Ryan and they were like oh who's Dr. Ryan we don't know so they don't even know कि हाँ कौन सी resources है. They spend so much time just thinking about it and not taking any steps to study. और जरूरी नहीं है you need Dr. Ryan या you would if you have subject same है knowledge same है questions थोड़े difference हो सकते हैं. Okay for US you need to be more proficient in English. That's the only difference. apart from that कोई सा भी ऐसा difference नहीं है that you won't get in India, that you won't get in Russia, that you won't get in any part of the world. So apart from procrastination, everything is sorted pretty much at every place. That's the single go-to message from my side. Do you agree with this, doctor?
Of course, I do agree what you have said right now. I do just agree. Do not procrastinate. That is really like needed in any of the professions. It's just not about the medicine. It's just not about any, and it's just about all of the profession or about your even your daily life. Okay, be your
Yeah.
service life, be your whatever you're doing. Okay, so procrastination just is the cause of like not letting you grow,
Yeah.
is the cause, like what is stopping you, it's the biggest hurdle for you. So if you understand that, stop procrastinating. Even I do sometimes, so to be honest,
That's simple.
everybody does. Okay, everybody
Yeah.
does, but try to reduce it, try to be more productive with your time. And of course, I will not say like everybody just come to Russia and study. No, Russia is a very beautiful country. You can travel across Russia in your vacations. You can you can go and watch the northern lights, or like
Murmansk.
many places are there. Murmansk, yes, of
Yeah.
course. You can watch the Baikal. So there are so many good
Mhm.
places you can visit. Okay, but visit, and then rest of the time that use for your education purpose
Yeah.
to make your life meaningful, and to become a really good profession person. That is what I'll say.
That's इवन आई ट्रैवल अलॉट रशिया में जब भी चांस मिलता है ना, इवन अ लॉन्ग वीकेंड, बिकॉज ऑफ कोर्स छुट्टियां तो मिलेंगी, तो उसमें ट्रैवल करना भी जरूरी है। ये तो मैं हमेशा बोलता हूँ, कोई भी ऐसा नहीं है दे आर जस्ट स्टक विद देयर स्टडीज एंड दे डोंट गो अराउंड, एंड इट्स मच नीडेड बिकॉज आई फील कि आफ्टर वेकेशन, शॉर्ट वेकेशन और समथिंग, यू फील लाइक चलो अब तो वापस अपनी पढ़ाई पे ध्यान देते हैं। बिकॉज अगर बीच में गैप नहीं लिया तो योर प्रोडक्टिविटी विल बी वेरी लो, और प्रोडक्टिविटी लो है तो फिर
Mhm.
एट द एंड ऑफ द डे व्हाट मैटर्स, डज नॉट मैटर कितने घंटे पढ़ा, क्वेश्चन सॉल्व हो रहा है नहीं हो रहा है, दैट्स द ओनली पॉइंट। उसके अलावा नथिंग मैटर्स। सो we covered most of the topics. Okay, let's think. Is there something we can give some suggestions, or even something, some points we can clear out for students? Because the questions I got, I kind of summarized it very short because बहुत सारे थे, और बहुत सारे तो useful भी नहीं थे. Like it was not even actually acceptable कि उसे explain करा जाए. But as per your doctor, because I have asked you all the questions, so is there something you want to convey to your juniors, or maybe someone who is studying there, like me, I'm your junior, and other juniors who are right now studying there, or someone who is planning to go there?
So my, like I'll recommend this to all of the people. Okay.
Yeah.
Um, you know, there is no such thing like if you study in India, if you study abroad. Okay, because see, like after studying even in any of the country, I'll not mention any country, in any of the country, and when you travel back and you give the FMG exam, you do your internship, you receive the license, you practice with the same IMGs, okay, Indian medical graduates, okay. So there is no such difference. So you just need to start your journey, okay. Do not waste, like my recommendation will be, so it's my personal opinion, okay. I don't know who will agree with this, who will not, but do not waste years. Okay, people
Mm.
usually waste a lot of years. Some people do, because there is a very hard competition in India.
Yeah.
People need to understand. Even parents need to understand that this year, even like more than 2 million people gave the NEET exam. Okay, so it was about like 20 lakh
Yeah.
plus students appeared in NEET exam. So not everybody will receive a government college, okay,
Mm.
government medical college. So you need to understand that yes, you have like you appeared in the exam, and then you scored some number, okay, you were qualified, and you qualified the exam, and you just need to start the journey, take the first step of your like medical career, to start your like your journey in medicine as soon as possible, because medicine is a long journey.
Yeah.
If you waste in the very initial, before taking admission, if you waste a couple of years, okay, later you will regret it. Many people regret it a lot.
Yeah.
Okay, I have to be honest, many people regret,
Um,
even I regret sometimes, like why did I waste this particular year? I could have taken admission. So this is people think like, so I would say like this is a message for all, not the students, just for the students, but also for the parents. Like if you're saying that your students are qualifying in the exam, okay, do not some people like pressurize the kids like okay, appear again and again and again
Mm.
and again until unless you get the like government
Mm.
medical
Sure.
college, and in the meanwhile you waste like several years.
Yeah.
Okay, so this is I feel like I don't know who will agree with my point,
Yeah, I would
but still
definitely
I'll
agree
say,
because
yeah,
I would say,
I'll say start your
yeah, I am
take
also
take a
like,
leap.
mhm,
Take a
I think
leap and start your journey as soon as
it's
possible. This
possible.
is
Yeah.
my recommendation. Books are same, knowledge is same,
Mhm.
everything is same, similar. I'll not say same, but similar.
Similar.
Okay, somewhere you will get something less, something you will get more. Okay, but when you are abroad, your overall personality and there are many things that are perks. Okay, there are many cons. Like yes, yeah, there is a like little difficulty in adapting in the new society, in the new country, in a new culture. So this is cons. Okay. Apart from this, I don't find any cons. Okay.
Oh,
Sometimes it
I'm
happens
like,
that you feel like you are having like less amount of practical skills. Okay.
mhm,
But these all things will be, like sorted. It's not that big issue
okay.
that you should be taking into consideration, because once you clear the FMG exam, you start doing internship in India. Okay, you will go through all the cycles, you will go through all the departments there in India, and they will teach you there. Okay,
Mhm.
whatever you have not learned. So just focus on at least what you're getting here. If you're getting good
Mhm.
theoretical part, just focus on
Focus
theoretical
on that.
part. If you have time and if you can manage your time, okay, I would say start going in Skorai Pamosh, which is the ambulance.
Yes.
Okay, in some like nursing departments,
Mhm.
this will aid your knowledge more. Okay, because practical things when you start doing it, you will learn and you will like hold in your brain for a very longer duration.
For sure.
And you know how to enact as a doctor. That is what,
Mhm.
not every time when reading the book you will understand like how you have to treat, how you have to do some kind of a protocol, some type of a
Mhm.
procedure. So sometimes the practical skills are really important. So I think time management is what you need to learn when you are abroad or in India. It doesn't
Yeah,
matter at all. So
for
this
sure.
is what my recommendation is.
Yeah,
Rest,
definitely.
everything is good. Start your journey. That is what I'll recommend to everyone.
Yeah, no, definitely, I would agree. 100% because I also followed the same path somewhat. I just turned 24, I'm 2001 born, and I'm about to finish my degree as of now. And now I have
Mhm,
some time actually to think about further degrees, like USMLE or any, because if I want to go perceive any of the specialty, I need time now because now I know that there is the competition is not finished yet. सब लगता है नीट नीट वही कंपटीशन आगे तो और कंपटीशन इज एवरीवेयर नीट पीजी के बाद में भी कंपटीशन मिलेगा ही when if you are going for jobs you need to be grown developed as an individual that depends so that's why I follow the same like you were saying and बहुत सारे बच्चे नहीं करते हैं उनका पर्सनल टेक है that's totally up to them इट्स टोटली अप टू यू जो है देखो बट सोच समझ के जो है उसे देख के फिर कर लो दैट इज द ओनली बेस्ट थिंग व्हाट यू कैन डू राइट नाउ बिकॉज राइट नाउ देर लाइक आई ऑल्सो रिमेम्बर लाइक यू मस्ट ऑल्सो रिमेम्बर जब हम उस टाइम पे थे जब हमें देखना था कि क्या करें कितना कंफ्यूजन होता है कोई कुछ बोल रहा है कोई कुछ बोल रहा है देर आर इफ देर आर 1,000 नॉट्स देर विल बी मे बी लाइक अ मिलियन विस्पर्स सो कोई बात का सर पैर भी नहीं होता कई बार they just make
mhm.
so many modifications and manipulations to the same fact that it ends up being completely contradictory to the first thought. So that is it. So thank you so much, doctor. I got all the answers, like what students were asking me. So thank you so much, I would say. And तुम लोग को पता नहीं है हम लोग कितने मुश्किल से कितनी बार कनेक्ट करने का कोशिश करे थे बिकॉज शेड्यूल बहुत मुश्किल हो जाता है ही इज इन्वॉल्वड इन सो मेनी थिंग्स एंड ही वाज ट्रैवलिंग आपका ट्रैवल कैसा था अभी
Yeah, it was really good. I went for observership in India.
या
So I finished my observership and it really went well. We have a MOU signed between our university and hospital in India. So I traveled there, worked with Indian doctors, and they were really kind and good for towards me. So they taught me things which I was not knowing. They didn't make me feel, like ashamed or embarrassed, like you don't know this, you don't know that. No,
या
didn't do like that. Okay, some things which I was not knowing, they just taught me. and they said that how you have to, like the right approach towards
Yeah.
learning. They taught me, and I was really grateful to all of them, that they provided me such kind of opportunity. Because as I told, I'm as in working as an administrative employee in our university also, but I also am a student. So it was really good for me. And right now it's 1 a.m.
Exactly.
that
It's almost,
it's
here
almost be
it's almost
1.
4:30. Like,
Yeah.
so,
Oh, wonderful.
yeah. So thank you so
So
much,
this
Doc.
is
Thank you so much. And we are so glad
okay.
that you took some time out and gave so much.
No, no, no. I really wish you all the best. First of
Yeah.
all, Saksham, you are soon gonna graduate. I wish you all the best, and I wish all the best to the upcoming students, those who are planning to study abroad. Just take the step as soon as possible. Your first step in this journey, take soon, like as soon as possible. Take your first step as soon as possible. This will,
Yeah.
you will thank yourself later in
Yeah.
your life. That was really good that you took your decision in your life, because life is unpredictable. Many things
Yeah.
happen, and like you are delaying things. Life keeps on changing, so grab the opportunity as soon as you get it. That is what my suggestion is to
Yeah.
all of you.
Okay. Thank you so much, Doctor. It was lovely talking with
Okay,
you. Yeah.
thank you so much for inviting me on your channel.
For sure.